Good day, fellow learners. This is your mentor, your fact check buddy, Ray Gapuz, joining you for another teaching and learning session for our next generation NCLEX RN pointers. And this is set number 29. Now, brace yourself as we are going to talk about three different topics that I would like to highlight. And I'd like you to listen carefully because I would be integrating functional concepts that you may want to remember as you prepare for your test. But before that, let me first begin with an advisory that if you are in a Ray A. Gapuz system class, you should be seeing me plus our group of mentors who are licensed in New York, like Mentor Che, Mentor Francis, Mentor Missy, and Mentor McLean. And of course, our mentors who are multi-state licensed, like Mentor Shans, who's US licensed in both the states of New York and Vermont, and Mentor Marisol, who is also US licensed in the states of New York and California. And of course, yours truly, I'm US licensed in the states of Illinois and Georgia. So if you are in a real Ray A. Gapuz system class, you are supposed to see us. Plus, Mentor Nicole, who is licensed in Ontario, Canada, and that test is also under NCLEX RN. Okay? So, I'd also like to invite you to join me in a 10-day high-yielding test preparations. We call it our Quick Fix Boot Camp, and it's going to happen on January 8 to 20, 2024 at Mount Crest Hotel, Gapuz, Baguio. So, this is a high-yielding test preparations programs that have helped a lot of nurses pass their tests from all over the world. Even people from the US and the Canada, and even from those who are far-flung countries of Africa, they come here and they're joining the boot camp. So if you want to be one of them and you only have like 2 or 3 weeks to spare to prepare for your test preparations for the next generation NCLEX RN, please do consider joining us in our boot camp. Now, the first question that we always address when we are preparing for the next generation NCLEX is, what are the things that you need to study? Only a real expert knows that. And an expert is not just anybody who just know how to deliver lectures. No. NGN will ask you more than the facts. NGN will ask you more than the things that you've memorized. Okay? So, let's begin with our first NCLEX RN alert, and that's going to be your Celium. Now, the indication for Celium is constipation. Why? Because your Celium is a fiber supplement and it is a bulk-forming laxative. So, as a bulk-forming laxative, there's one important thing that you have to instruct your client to do. They have to take the supplement with water, 1 whole glass of water. So they need to take 6 to 8 glasses of fluids per day, because if they don't take it with fluids, Celium will absorb water from the gastrointestinal tract and may potentially obstruct the GIT and even may potentially cause choking. So a common side effect of Celium is bloating. Now, the medication can be taken with or without meals. So it really doesn't matter. Is it safe to take it every day? Yes, but if your objective is just to cleanse your bowels, then it's best taken for 3 times a week only. Okay? Now, when your patient is taking your Celium, remember that Celium can potentially interact with 3 common drugs. And remember the code CAD, C-A-D, C, cholestyramine, which is a bile acid sequestrant. Your cholestyramine also causes constipation and may reverse the effects of Celium. What cholestyramine does is that it prevents the accumulation of bile salts in the skin in a client with cholelithiasis. Therefore, it decreases pruritus. Then CA, letter A, you have your amitriptyline, that is a tricyclic antidepressant that may potentially cause palpitation. So if your patient's taking amitriptyline, you better check the client's ECG tracing before giving the drug. And your amitriptyline is slow acting. The initial effects would occur 2 to 3 weeks after, and the full therapeutic effects would occur 3 to 4 weeks after. Now, amitriptyline Even if it's a tricyclic antidepressant, it's also used in patients with neuropathic pain. So in clients with cancer, your tricyclic antidepressant amitriptyline is used to decrease pain. So your parameter of assessment for amitriptyline should be the pain level of the patient if it was given to a patient who is suffering from cancer. Next, CAD, digoxin. Take note that your Celium may interact with digoxin. It's a cardiac glycoside. And if your patient's taking digoxin, check the heart rate. There has to be a minimum of 60 beats per minute. And if your patient is taking digoxin, take note that digoxin toxicity can develop, and it's usually manifested by a greenish or yellowish green vision, medically described as xanthopsia. So pay particular attention if your patient all of a sudden develops visual abnormalities and verbalizes discoloration of the things around them or within their immediate environment. And of course, your digoxin may potentially cause bradycardia, and sometimes when there's digoxin toxicity, they may exhibit persistent anorexia. Since digoxin increases the force of cardiac contraction, it's essential that the effects of digoxin must be evaluated in terms of the urine output if it is given in a client with congestive heart failure. So take note, digoxin is primarily excreted by the kidneys, so it's very important to check on the urine output and the serum creatinine, and of course, the blood urea nitrogen levels. If these laboratory tests are elevated, therefore, clarify before giving the next dose. Because if you proceed in giving the next dose despite an elevated creatinine, an elevated BUN, or a decreased urine output, then you could be held liable for malpractice. Now, what about if the patient is having diabetes mellitus? Can they safely take Celium? Celium interacts with insulin, and Celium may potentially worsen hypoglycemia. Therefore, if your patient is taking medications for diabetes, it's very important that before giving the Celium, you have to clarify it with the physician. Okay, so I just hope you're learning with our first NCLEX RN alert. Before we proceed, let's get inspired. Here is a lady who recently passed the NGN. We have Abigail Cabanes, who's now a USRN, and let's learn from her experience. So she begins by saying, so eto na. In English, so this is it. Dati sinasabi ko lang, I'm next at nagkatotoo na nga. I used to just say I'm next, and now it has become a reality. 3-day quick fix lang na attend ko dito sa Ray Gapuz review system. So I only attended the 3-day quick fix. Yes, you heard it right. The 3-day quick fix at the Ray Gapuz system. And this is what she has to say to add on to those things. Pero super worth it. So she said that in Tagalog, which means in English, it's all worth it. Mahahasa talaga ang pagsagot mo. Yung mga exams, grabe, mas mahirap pa sa NCLEX. You will really get used to answering questions because the questions that they're using are more difficult than the real NCLEX. So thank you, Sir Ray, sa mga lectures, sa masayang discussion. So just essentially saying thank you, Sir Ray, for the exciting lectures and discussions. Naalala ko yung first simulation test namin, nasa 62 pa lang ako, nag-shutdown yung PC ko. Haha, niloloko nila ako na USRN na daw ako. Ulitin ko na lang daw. Okay, what she's saying is, she remembers that on her first simulation, yes, we do have a simulation room for NJN at the Ray Gapuz system. She's still on number 62 and her PC shut down. And the technicians at the office were actually telling her that she's now a USRN because her computer shut down, okay? And then they told her to just repeat from the beginning, okay? And then she continues, kung alam nyo lang, ang hirap-hirap ng mga questions, inaabot ng gabi, okay? She's practically saying, if you knew it, you wouldn't dare do it because the questions were really difficult and sometimes it takes us until the wee hours of the night to finish it. Lalo nung day 3, puro exam talaga kami. Pero yun nga, para sa atin din naman yon. especially on day 3. We really had a lot of exams, but it's really for us. Okay? During the exam, naririnig ko voice ni Sir Ray na parang gaga, haha. So during the exam, it's as if I'm hearing Sir Ray tell me, you stupid. Okay, gaga. So, mapapa, oo nga, malito. Repeat, repeat. So, I get to realize maybe I'm interpreting this incorrectly. So, I have to repeat and read it repeatedly. And then, nag-stop ako siguro 106 yata. So, I stop at number 106. For 2 hours, natapos ko yung mga exam, Basta mas madali yung NCLEX compared kay Sir Ray. So, what she's saying is, I finished the test in 2 hours because the test is easier than what Sir Ray is giving. Kaya kung kinaya niyo ang mga exams niya, mas madali na lang ang NCLEX. Okay? So what she's saying, if you are able to cope and answer the exams that I've given, NCLEX is easier. And then this is what she says. Hindi sa OA ako ha, pero sa true lang. I'm not overacting or exaggerating. I'm just stating the truth or the facts. So super thankful po kasi lumakas loob ko na magsagot ng exam. So she's saying, thank you very much because you increased my confidence in answering questions. God bless you, Sir Ray and the staff, and good luck future USRNs. That's Abigail Cabanes, USRN. Look at her experience. Okay. And I know all of you would want to be like her. So join us at the Ray Gapuz system and you'll be one of the next future USRN. So that's Abigail Cabanes from the University of Perpetual Health System, Binan Laguna, who passed the New York Board of Nursing last November 4, 2023. Okay, our next NCLEX RN alert is actually your premature ventricular contractions. Now take note, how would you recognize the presence of a PVC? Okay, on the ECG tracing, you would notice an inverted P wave, or this is what we call retrograde P wave. Okay, so how do you explain premature ventricular contractions to your patients? Just tell your patients that they are having extra heartbeats. So the common sign, which is also the first sign of premature ventricular contractions, would be there will be pounding on the chest or jumping heart rate, medically described as palpitations. So, is this expected? Is this harmful? Well, if it just happened once, it would just require further observation. However, if you have 5 or more in 1 minute on a routine ECG, what do you need to assess the patient for? Assess the patient for the factors that could potentially have triggered your PVC. And the 2 common factors would be CS, caffeine, and smoking. So instruct the client to stop drinking caffeinated beverages like energy drinks or coffee, and then stop smoking, or better yet, quit smoking. Now, the danger of premature ventricular contractions when it occurs that frequent, like more than 3 or more than 5 in 1 minute routine ECG, is the fact that it could develop into ventricular tachycardia and eventually to ventricular fibrillation, which is the most dangerous type of arrhythmia. Okay? Now, what's the first line of treatment for premature ventricular contractions? As a nurse, what should you anticipate the doctor to order? What would you prepare? So prepare your beta blockers, okay, specifically your carvedilol. Now take note, carvedilol may potentially worsen hypoglycemia if your patient is receiving insulin glargine. So you have to clarify that combination with the physician. And of course, another beta blocker would be your metoprolol. Take note that your beta blockers may potentially trigger bronchospasm. So assess if the patient is diagnosed to be having history of asthma or has had asthmatic attack recently. So you have to clarify the doctor's order before giving it to an asthmatic patient. And of course, antiarrhythmic medications like amiodarone or flecainide, these are the things that you have to anticipate the doctor, okay, to order for the patient. So the treatment, remember, let's have a code. Remember, CLAP, okay? So prepare carvedilol, lidocaine, amiodarone, and propranolol, okay? And the most important thing that you have to remember is which among these drugs should be used first? Remember, you always begin with the beta blockers. So once again, carvedilol, lidocaine, amiodarone, and propranolol. With these combinations of drugs, what type of, which specific vital signs should you monitor? Two things. One would be the pulse rate, because your beta blockers could decrease the pulse rate. And two, definitely would be the blood pressure, because your beta blockers would also potentially cause hypotension. Okay, so remember, your PVCs, it's not harmful if it occurs in isolation, but when you have 3 to 5 of it in a 1-minute routine ECG, then you have to refer that immediately to the physician. So join our hundreds of thousands of passers from more than 30 countries worldwide. And recently we have a 60-year-old who passed NGN through our program, joined by more and more and more and more and more of these passers. Okay, so next important thing that you have to remember for your test would be acute kidney injury. Now, what are the things that you have to remember related to acute kidney injury? First and foremost, how do you explain to the patient when the doctor tells the patient you have acute kidney injury? Tell the patient that in acute kidney injury, your kidneys suddenly stop working. As simple as that. Okay? Now, if the patient would ask you, is it reversible? Yes, it is reversible. Okay? And when the patient would tell you what could have caused it, remember DID, D-I-D. Okay, the first letter in that acronym DID means decreased blood flow. So acute kidney injury could be associated with conditions that potentially could lead to shock, okay, when your patient's having hypovolemia or bleeding, and then I, infection. And these infections could actually lead to strictures that could block the flow of urine, okay? So take note, decreased blood flow, infections that could lead to strictures that could block the flow of urine, and the last D, damage due to medications as well as autoimmune conditions. Now, what medications can potentially cause acute kidney injury? The nephrotoxic drugs. Examples would be your aminoglycosides, okay, streptomycin, neomycin. So you need to check if the patient all of a sudden develops oliguria, meaning a decreased urine output. Check if the patient could be taking any of these drugs. And if a patient has been diagnosed with acute kidney injury and the client develops secondary infection and the doctor orders neomycin, clarify the order before giving it to the client, as your aminoglycosides are nephrotoxic and could therefore worsen the acute kidney injury of the patient. Okay, now let's try to figure out what could have brought the patient to the hospital. If the patient is indeed suffering from acute kidney injury, note for changes in urination. Usually there's decreased urine output, and then another sign of faulty kidney function would be swelling. So you have edema of the face, the arms, and the legs. And of course, because your kidneys are responsible for the production of your erythropoietin releasing factor that stimulates the bone marrow to produce more red blood cells, in kidney injury, eventually the patient develops anemia. So fatigue is a common manifestation of acute kidney injury. Now, if the patient would ask you, what type of diet should I be in if I have this type of kidney condition? So the diet should be low phosphorus. When you say low phosphorus, avoid those that are high in phosphorus, like tofu, okay? Like, avoid those that do not, When your patient is in a low phosphorus diet, what can you serve the patient? Tofu and fish, okay? So avoid those that contains your phosphorus. So to be safe, just serve fish and tofu as their viand, okay? So the next question that we need to address is, how do you study for NGN? Study using technology. You have to learn how to navigate the different types of questions using a simulator. And here at the Gapuz system, we have a lot of tools to assist you. We have NCLEX RN in a flash, the local title here in the Philippines is NCLEX 311. Of course, the US title is published rather by Jones and Bartlett USA. So here's our passer from Nigeria. I asked her, Lester, which part of our review helped you the most? And she says, I will say the 311 book. Okay, so this is NCLEX 311, which is given for free to those who are enrolled in our full package. The good thing about the book is you have the functional concept, all 311. That's why it's called NCLEX 311. And you have some pointers here, sample question, which is very essential, the answer, and then the rationale. Now, the international title of NCLEX 311 is NCLEX RN Flash. Okay, look who is the author. That's me, and it's published by Jones and Bartlett USA. So they have the same content. Okay, this is the Philippine edition. This is the international edition. The difference is, of course, the international edition is colored. It comes in full color. And of course, Lester also says the comprehensive classes were also very reassuring. So our comprehensive review could last 2 to 3 months if you're doing it on weekends. If you're doing it every day, it would last for an average of 20 to 30 days and take note. Okay? You can sit in unlimited frequency. Okay, so the most important thing, according to Lester, is of course the core shells. Now, the core shells organizes your Q bank, your videos into one. And this is also given for free access, unlimited access, if you are enrolled in our full package review. So once again, it contains all the subject areas in NGN. So it's covered safety and infection control, basic care and comfort, health promotion and maintenance, management of care, pharmacological and parenteral therapies, physiological adaptation 1, 2, and 3, and of course, reduction of risk potential and psychosocial integrity. Okay, next, when you're preparing for the test, you have to be in a conducive environment. That's the third but the most important preparation strategy for the NGN. Here at the Ray Gapuz system, our class is in a comfortable environment, comfortable size, and we have our NGN simulation room with 1 student to 1 computer. Okay, so may I invite you to avail of our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. The fee starts at $3,499. You can choose between weekdays and weekends, morning session or afternoon session. It's your choice of live face-to-face class, live virtual class, on demand, unlimited video recorded videos, okay? And of course, QBank and the 3 books that includes my NCLEX 311, plus the strategies and the quick fix sessions, which will be done for 3 days within the month of your test. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you for joining me in this learning and teaching session. On to my next video. If you want to shut down at number 85, watch out for my next one. Take care and don't forget, Jesus loves you.